Hi, I'm David Gottenborg at Gottenborg Chiropractic here in Pelican Rapids, and I want to talk about three different things today that are interesting to me. And one of them is, how do we help infants or young children? The second thing would be, how do we help people during their pregnancy, or in some cases when the baby isn't positioned quite right, a breech presentation. And last of all, a unique aspect of chiropractic called craniopathy. Craniopathy is a technique within chiropractic that dates back to almost the beginning of chiropractic, and it was a technique that was in a way refined by an osteopath, Sutherland. But here's how we use this, or here's how we describe it to people. For example, with young children, we all know they have a soft spot. And newborn babies, we can see these different sutural plates. And what craniopathy is, it's a technique used by chiropractors where we apply pressure to actually have an effect on these cranial faults or sutures. In fact, until the day we're dead, there is motion within each and every one of these plates. And they can have some really dramatic effects when the so-called customary type of chiropractic care doesn't work. So we might use this with people that have weakness in a leg, blood pressure that doesn't change, intractable pain, people that just don't respond the other way. We also use this as the foundation of treating the TMJ patient. So if you've had problems that don't respond to anything else, there are still therapies, there are still manipulative techniques like craniopathy that might work for you. The second topic today is pregnancy. So to cut right to the chase, there are instances, more common than one thinks, where people are having pain across the lower back or sacral area or across the pubic bone. In some cases, we even help mothers that have a breech position with babies. And so what's really important to understand here is there are a couple very strong ligament attachments. One that comes from the sacrum, it attaches to the uterus and cervix. And the other one is the round ligament that comes off of the symphysis, and it angles upwards and supports the uterus from the side. By evaluating the lower back and pelvis, we try to identify any fixation or issue with alignment. Once we correct that condition or alignment, we then turn our attention to holding pressure on either the right or left, the round ligament, which in many cases relieves that low back discomfort, relieves that discomfort that originates around the pubic bones, and in more cases than not, is very effective at changing the position of a baby from a breech presentation. The last topic that I want to talk about is, when is the right time to look at a child or an infant or a baby? Depending on the birthing experience, care could begin in a matter of days, if not weeks, after delivery. And so while we're concerned about the entire spine, most of the problems I see are upper cervical. And so as a baby is born, if it's in a head down position, the head is then, or the neck is then rotated, and then the shoulder is delivered, and then the opposite shoulder. So there is a lot of stress on the upper cervical spine. How would you know this? Well, does the baby feed differently on one side of the breast or the other, or when you're bottle feeding? Or when you lay the baby down, does it hold its head in one position because it's uncomfortable in the other position? These are some really key little figures or key ideas, other than the classic colic or burping up a lot. you know what? These are really 3 interesting topics. I tried to cover them quickly, but if you have more questions, contact us here in Pelican Rapids.
Thank you for watching Wellness for Life.